Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and our special guest today is Pat George. Pat has been the president and CEO of the Valley Hope Association since July 2015. He has served on the board of directors since 2003. He has a distinguished career in business and public service. He was the Kansas Commerce Secretary from 2010 to 2015 and served in the Kansas House of Representatives for 6 years. Pat has a 25-year track record of starting and building successful business ventures, from his family's automobile dealership to real estate development to professional sports. He is dedicated now to helping those suffering from addiction, one person at a time, honorably and respectfully. Welcome to the show, Pat.
It's great to be here. I appreciate any time that I get Neil to talk about what we do here at Valley Hope, and it's certainly not about Pat George, but I've been prepared as I look back over my last 25 years to be part of this great organization that just celebrated its 50th anniversary last weekend. And I recently celebrated 25 years of being drug and alcohol free. I'm actually a byproduct of the Valley Hope way of treating and dealing with the addiction problem. So not only do I work in the industry, but I have benefited from the treatment process myself, as well as my father. My father was one of the first patients back in 1968 at the Valley Hope facility back then. And so to get a chance to come work for an organization that saved my life is quite an honor.
Well, congratulations on 25 years of being drug and alcohol free. And it is an extremely important position that you're holding there at Valley Hope. Now, let's really get into it, because this is a major problem in this country. But basically, or briefly describe to me, I know you could talk forever about this, but what is drug rehab?
Well, that's a good question, and many people ask that, including many in the medical profession. We've been working on educating those that come across people that are suffering from this disease of addiction, and some of the people, the professions that we're working with is both doctors and other healthcare professionals, as well as those in ministries. Different ministers, priests, rabbis talk to us about the number of parishioners that come to them with a problem. And so what do you do? That's what the doctors say. I received little training when it comes to addiction, and typically it's a pretty sensitive subject, and if I bring it up, I'll probably offend my patient, who's oftentimes has been coming to see me, and we have a friendship, and he's going to be upset about it. But yet, I care enough to, and that's what I do for a living. But then after I bring it up, I don't know what to do. And so that's where our education process has been increased, and many other treatment centers are doing the same. And so let me describe a typical time. I'll describe myself, Pat George, when I checked into treatment 25 years ago. I was, a number of assessment tests were given to me, as well as a physical to determine, my physical state. And it's pretty rigorous process. And then plus many times there's a physical addiction as well as the mental addiction. And so to assess the type of detox that I need, and I would say 99% of the patients that present at Valley Hope and at most treatment centers are of the severe category, and a detox is needed. And at Valley Hope, our detox rooms are monitored 24/7 by a nurse. There could be medications that's involved to ease the withdrawal symptoms that can be deadly, and especially with this increase in opioids, which we'll get to here in a little bit. But alcohol is a really tough detox as well, and can be deadly. And so we try to make that process as less painful as possible. And then also with opioids, we might introduce some anti-craving medication at that same time. And so for myself, I was in the detox room for 3 days before I moved into the what we would call the general population. But that detox could last from 24 hours up to 10 days. Just everyone's different. We monitor them individually. So my typical day, being in treatment after the detox process, would be to start with breakfast at 7 in the morning, and then there's a optional chapel service at 7:45, and then our first group is at 8:05, and this is what we call communications, where you get your assignment. If you visit with your counselor, at what time your appointment is. At Valley Hope, we're a little unique. You're assigned both a counselor and a chaplain. We believe that the spiritual aspect is part of the three-legged stool, so to speak, physical, mental, and spiritual. And we're not a specific faith-based organization, but we certainly believe in spiritual recovery as part of the process. And so after the 8 o'clock, we'd have a 9 o'clock lecture dealing with the education of what addiction, what it is, and how it affects you. And then in between 10 and 11, you might visit with your counselor or your chaplain. At 11, typically there's another lecture mainly dealing with the self-help groups and the 12 steps. And then in the afternoon, there would be maybe a small group or some specific. There might be a group for parents or a female or male group that would get together, and which is very therapeutic. And then at the end of the day, our patients are encouraged to take part in a 12-step program, Alcoholics Anonymous or Narcotics Anonymous or Cocaine Anonymous, or something. And what's different, and I didn't realize this, even though my father had been in treatment and I knew others. I kind of envisioned a jail-like atmosphere where we'd be locked up. But going back to our founder's mission, our first executive director back in 1967 had some luck working with alcoholics. Back then, you're just as likely to be locked up in jail for a week or go to a hospital for a week or two, and nothing more than that. But he believed that what an alcoholic needed more than anything was love. And so Valley Hope was founded on the mission of helping those suffering from addictions and alcoholism. And the way we treat them is with respect and love. And so if you would envision checking into a hotel, our grounds are not fenced in, you're not locked in. We believe that responsibility is to be taught as well. And I remember coming to treatment, and they told me the most important thing I could bring was my alarm clock, and that's because you're not going to be catered to. Nobody's going to come around and wake you up. You're expected to get yourself up, and that illustrates just a part of the recovery. And then we're very conscious and adamant about the patient group itself and the therapeutic effect of one alcoholic helping another. And so this milieu that we constantly are creating with the patient group, we feel that is as important to someone's recovery as the actual counseling and education process. So it's a very, at Valley Hope, it's a very loving atmosphere and caring atmosphere. And to tell you just something that probably touches my heart more than anything is our graduation ceremonies. We call them a cup hanging. If you think 50 years ago, there wasn't too much, paper cups or styrofoam, that was just coming about. And so you were given a porcelain cup when you checked in, a white porcelain cup. And as many traditions, have an innocent beginning. Well, people started painting on their cups, and they might paint, or write the name of their kids or a Bible verse and that. And so our graduation ceremonies now, the cup that you're given when you check in has become a symbol for your recovery. And we ask that you hang that on a hook in the lecture room and then come back and pick that up when you've completed a year of being in recovery. And they're very touching, these graduation ceremonies. And what always brings a tear to my eye is, of course, the counselors and chaplains and other staff are there, but you'll also see the maintenance people and the cooks and the people that work in the kitchen are there as well, because everybody feels part of the process. And the people in the kitchen take great pride in helping, you regain your health.
Right. It's a personal journey, definitely. And, it takes a whole team to get somebody to the stage of being able to have recovered and not to relapse and to get educated, like you said. But it's not really a specific kind of person that needs help, which might be one of the misconceptions about drug rehab. I'm looking at Google here, and they've got drug rehab for teens, drug rehab for couples, drug rehab for families, for single mothers, for vets. I mean, it seems like it's not just a certain kind of person that it affects. It really affects everybody, does it?
It really does, and it's one of those maybe an eye opener for somebody that hasn't been to one of our facilities, and it's actually heartwarming because we treat all walks of life. You might come into one of our treatment facilities, and you'll have maybe some members of the local motorcycle gang, and also doctors and attorneys and housewives and mothers and radio disc jockeys and people from the political world and everything else in between. And what they share is this battle with addiction. And it's a chronic disease, just like, cancer or diabetes. It knows no boundaries. The good thing is that there is help and recovery is available. And I might just give a shout out for those listening that if you go to valleyhope.org, all kinds of information on how to get help. And as you mentioned, Neil, you Google, and there's just a lot of resources. And to take, what one of our big efforts nationally is to take the stigma out of it. If all of a sudden I had some spots on my skin and one of my friends said, well, maybe you ought to get that checked. You might have skin cancer. Well, I wouldn't hesitate. I'd be calling up and getting into the doctor as soon as possible. But, if one of my friends said, hey, Pat, we think you might be drinking too much, you'd probably say, well, mind your own business. What are you talking about? And, we're trying to reduce that stigma, because the sooner we can help somebody, the better the results. It doesn't matter what the health issue. And when you see the results, Neil, I was doing some calculating last night, and these are, I know this is a business show, and so many of the listeners out there, manage or own or run businesses, but the costs are staggering. What they the cost to not just the family or the individual, but to businesses and to society as a whole. So I'm going to throw some numbers out there. Last year, we touched 17,000 people. So that's just Valley Hope. There's many treatment centers out there, many fine ones, some maybe on the edge of not being quite so fine, like anything. Mm-hmm. But so inpatient, outpatient, online, significant others that we had a direct influence on numbered 17, just a little under 17,000. So if you just take that, half of those people got into sustained recovery, so 8,500, and the costs, and I've seen this several places, over a lifetime, if you help somebody with efficient and correct treatment, and they are able to maintain their recovery over a lifetime, the savings, the economic impact is about $1 million a person. So I was computing that to the influence that Valley Hope did. Our greatest impact is that we help somebody stay alive and help keep families intact. But that transposes into many generations that we help. But $7 billion of economic impact, $7,500,000,000. Just based on the people that we helped last year, that it will have that positive impact over their lifetime. And
I mean, that truly is amazing, Pat. Just the numbers that you mentioned there, and that's what some people don't realize is not only does it cost to go through rehab, and there's some money generated in that industry, but really it's the lack of productivity from just you yourself, from 17,000 people, that when they have these problems, they're not really being productive. It is a drain on the economy in that sense.
Oh, absolutely. The cost, to their families, multiplies that, and showing up late or showing up in a altered state of conscious or hungover. It takes up the time of their managers. Their coworkers are affected. Oftentimes, it just creates a hostile work atmosphere. So there's all kinds of cost, besides the direct cost to either out of their pocket or insurance or disability benefits. It's staggering, and I think this is just starting to be learned that an investment over the short term and to do treatment right. I've been fighting the insurance industries, and I have many friends there, and they know I have a passion for this. But one of them told me 5 years ago, and I didn't like the answer, but it made me, as a business guy, understood what he was saying. I said, there's all kinds of data and science that shows that if you help this person with this chronic disease of addiction, that the healthcare cost, the cost to public cost, of avoiding accidents and not ending up in jail far exceeds the initial cost of doing treatment right. And he looked at me and said, we don't think in those terms because the average person changes jobs 9 times during a lifetime, and each time they change jobs, they change insurance carriers. So we're looking at a 2 to 3 year window. Well, that was kind of a sad, I understand it from a business standpoint, but that has changed some recently, just because of the awareness of the cost and with ACA, and we all know that the Affordable Care Act has its problems, but one of the things that it did is make insurance portable. So insurance companies are taking a more long-term look at, how can we do effective treatment, not just a token treatment that says, we provided 7 days of treatment and it didn't work. Well, it didn't work. That'd be like me needing 3 stents and I only get 2. Right. And say, well, that didn't work.
So, Pat, let's change directions a little bit here and talk about the problems. Why are drug and alcohol addiction such a problem in the United States right now?
Well, we've had kind of a perfect storm, and a lot of attention has been drawn because of the increase in opioid use. And so you go back about 10 years ago, and it seemed pretty innocent that the CMS, the kind of the healthcare arm of the federal government, started measuring how well your pain was controlled. And so it actually affected the pocketbook of our healthcare industry and doctors in particular. And so if I'm being graded on how well I controlled your pain after surgery and it affects my pocketbook, well, I know how to control pain. I just prescribe this hydrocodone, an opioid, and I do it innocently. And so I know that when I take this pill, I physically feel a little bit better. And if I have a propensity for addiction, and I'm carrying a load of emotional strain as well, I've noticed that when I take this pill, I feel a little bit better mentally. So in 30 days, when the physical pain is gone, I still have some mental duress going on in my life. And the thing about opioids is that they are quickly form a physical addiction to them. And so doctors started prescribing more and more pain medications, many of them with an opioid base, which is very addictive. And we have found that perhaps opioids in themselves are maybe the only drug that if you don't have the addiction gene, so to speak, that you can still form an addiction with opioids, or it's a lot more common, and it takes just a matter of days instead of years forming an addiction to alcohol. Maybe in 90 days, I've gone from being very productive at work, or, what's sad is we see young people that, I've read countless stories of Johnny that was, an A student and competed on the football team and got his knee hurt. And then 6 months later, he's addicted to an opioid. And so we started seeing and recognizing this, and it became alarming because of the number of suicides, and it was affecting every socioeconomic status out there, and so middle class and upper class and lower class, young people were dying, and so the policymakers, both at the state level and in Washington, said, hey, what's going on here? And of course, the drug makers are complicit in this too, in that they were promoting their new pain-killing drugs to the doctors, and the doctors are getting paid to control pain, and so is a perfect recipe to increase the availability. Well, then 3-4 years ago, we started calling back on that, and states started putting some clamps down on the medical field not to prescribe so much. And at the same time, the Mexican cartel that have supplied mainly, the marijuana supply to the United States, and the heroin that came in, which is a same chemical makeup as other opioids from Mexico, it was an inferior grade. Well, the cartels in Mexico, they went and imported the scientists from Colombia. I don't know if they did that with cash or with guns, but anyway, they brought the scientists to Mexico and started making a much pure, better quality heroin. And they already had the transportation links in place, and so there is a great influx of heroin coming into the United States. At the same time, we were making it tougher to get prescription pain medication. So, I might have someone that still has some pain, plus I've become physically addicted to the opioid pain medication that I was receiving, but now my doctor refuses to write it. And the cost of the pain pill on the street's gone from $5 to $40. At the same time, heroin I can get a daily dose of heroin for $5 to $10, and it's a better quality than it ever has been. So that's kind of the perfect storm, Neil, of how we've got to this point where most of the percent of people affected by alcoholism, which is still the number one drug that's abused, has remained constant in that it's gone down a little bit from, say, in the mid 50% to around 50%. And cocaine and methamphetamine and marijuana has remained pretty stable, maybe a percent or two down. But the opioid addicts have more than doubled. I know here at Valley Hope, which is a pretty significant population, numbers-wise, has more than doubled. We've seen an increase, what used to be 13% of people that checked in presenting with an opioid problem to about 28% today, and that happened over a 6-7 year period.
Well, that really is amazing. Now, let's talk about some of the misconceptions a minute. You touched on some there that, I think some people think when it's just a drug problem, somebody's addicted to drugs, it is the drugs on the street, which is the heroin, the coke, and whatever else. But really, it is a huge prescription drug problem as well.
Huge, and both at the state level and the federal level, they're trying to get their arms around it. Some of the states have drug tracking, whereas up until 3-4 years ago, I might have 3 different doctors prescribing me a painkiller, none of them aware of that, and I go to maybe 10 different drugstores, pharmacies to get my prescriptions filled. And now many states either have or in the process of instituting drug tracking, through technology that would identify that Pat George, already has one drug prescription for hydrocodone. And so if I go to the dentist, my dentist is not going to write me that prescription. Or if he does, then the pharmacy will be able to quickly, through the state data bank, see that I already have a prescription and not go there. And it's sad that many of the opioid addicts that we treat here at Valley Hope, and I'm sure nationally it's the same, it got its start in the medicine cabinet from their home or their grandparents' homes. Countless cases of a teenager that is robbing grandma's medicine chest because she has a prescription for painkillers. And I've just recently had personal interaction with a young couple in their early 20s that have become addicted to painkillers, and they know that they need help. And I asked them their source, and it was both sets of grandparents that were treating, like arthritic conditions with a type of painkiller that they basically were blackmailing their grandparents into filling these prescriptions a lot more oftener than they would need them, so they could satisfy not only their addiction, but also use that as income. So we are seeing an alarming number of those type of cases where the prescription drugs are abused.
Well, Pat, there's 2 main questions that come up when I search online, and those are, and I want to get to these. We're kind of running out of time here, but I want to get to these main questions because they're big questions. First of all, is how do you get somebody to rehab when they don't want to go?
Well, and that's a great question, and something that we deal with all the time. And me personally, I've made no secret of my challenge, my battle with addiction, and having been in a public place. I don't mind publicizing that for the reason that it could help somebody. And so I get many calls loved ones, parents, spouses, significant others, that have a family member or friend that they know is slowly or rapidly killing themselves. And so, unlike the show's, intervention, there's a proper way to do it. But I always encourage people, just to be honest, and you know what, they might get mad, but why are you doing this? Why are you confronting them? Is it because, you have some spite, or is it because you love them? And just as if I, had another chronic problem, a heart disease, and you notice that I was maybe panting when we go exercise or walk, you would caution me, hey, why don't you get a checkup by the doctor? And so there's no better way than to directly confront it. I prefer, that if you have somebody that's been through the process, it's always helpful, just like me being part of many family interventions, I can talk about, I was sitting on that side of the table, 25 years ago, that was me. And if my mom and a few other friends of mine didn't love me enough to confront me, I would be dead. There is no doubt about it. And so there were people in the room when I was confronted that were in recovery themselves. And so that's a way to do that. There's many resources available. Just in most communities, Alcoholics Anonymous has 800 numbers in nationwide. And there's member of those support groups that would be willing to be part of that process. And then the other thing that we pride ourselves on here at Valley Hope, and many treatments do, is that we have trained professionals to answer the phone, to help answer questions, and to make it less threatening. And we've been working nationally to remove the stigma. I knew I needed help, but I couldn't quite, verbalize that. I couldn't quite raise the white flag and say help. And so by bringing it up, it's scary, but I can tell you from my own point of view that I appreciated those that had the courage to come to me and say, hey, we love you enough. We think that you got a problem and we want to help you.
Well, the second main question, once people decide or have been convinced that they need help and they need to check in, is about the money. Obviously, it takes a lot of money to be able to treat these people, but what are the solutions? I know there's insurance, there's some government programs. What kind of solutions are there for people that need the rehab?
And great question, Neil. There's a broad spectrum of help available from both local and state-funded facilities. Every state, I've done national work, every state offers some level of treatment. And then everywhere in between, you have the high-end facilities that run anywhere from $30,000 to $60,000 for 30 days of treatment. To those, Valley Hope is a nonprofit charitable organization, and we have 700 employees, and they want to get paid, and we have lots of need, to constantly upgrade our facilities that we do. But we like to think of ourselves as being available to anyone, and we treat from people that don't have any means to those of very high net worth. An average treatment period at Valley Hope, we actually have a traditional program that we call it that's 25 days, and the cost on it is a little under $11,000. So if you think of a hotel room that you pay $200 or $300 for, that's what we're charging. Plus you get meals, doctor care, nursing care, counseling. But we also, one of the things I'm most proud of is that we provided over $20 million in charity care last year. And a lot of times, if you have some means, we'll use charity care to help cover part of the cost. You mentioned insurance. More and more carriers cover for treatment. There's over $1 billion extra was allocated through the federal government, and we see that figure only going up as there more and more attention being drawn to addiction. And as we talked about the cost, well, the same is the savings. And so I think policymakers are realizing that an investment to help people suffering from addiction is a wise investment.
Definitely. Well, Pat George, I appreciate you talking with me today. We could talk for quite a while about this subject. There's a lot of questions. There's a lot of stuff that we haven't answered yet. But leave me with this. People that are listening to this and know that they need help, or family members that know that they need to take some action, what are the steps that they need to take? And specifically, how do they reach out to you and contact Valley Hope?
valleyhope.org. Our 800 number is 800-544-5101. And I encourage you to make that call or to research online. You can also reach us, electronically, chat features, email us. But people ask me about the timing. I always say, there's never a good time, so there's no better time than the present. And just like any other disease, the sooner you can start treating it, the better the results. So I encourage those that maybe have been hesitant to reach out to help somebody, or if it's yourself that you know that you have a problem and you just haven't been able to get on top of it yourself, don't hesitate to reach out, do the research at valleyhope.org, or give us a call at 800-544-5101.
Well, thanks very much. We've been listening to the President and CEO of Valley Hope, Pat George. Thank you very much, Pat, for sharing your time and your expertise with me.
Thanks, Neil.
And to our listeners, if you like what you hear, hit that like button, share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show, or to listen to past episodes, visit businessauthorityradio.com.